Just to make kind of a couple of generic comments, I think there's an old saying, be careful what you ask for. I mean, I was the Care Advisory Committee representative here in Florida for years and looked at local coverage determinations. So I think we always would take that with a little bit of local coverage determinations and to the same extent national coverage determinations. It sort of sets the ground rules as to exactly what it is, but it also limits in many ways. And I think the concerns are that this national coverage determination for CAR T cells may, in some ways at least, be a little bit too narrow, too restrictive in the sense that it limits it to just certain institutions. And as I say, I don't ever see CAR T cells as being something that every medical oncologist is going to be doing. There are certainly big practices in private communities and in private practices that potentially have the capabilities of doing that. One of the other concerns, I think, with that NCD or with the national coverage determination was that it limited off-label coverage just to one of the compendia, whereas historically, we've always used off-label coverage. We've used this several compendia that we've been allowed to use. So I think that's a bit of a concern. The coverage with evidence-based determination is, I think, a good thing. I lived through that with PET scanning and prostate cancer, and I think that was a wise thing that the FDA, not the FDA, but the CMS, thank you, that the CMS did to do that, and they came out with policy after that was, I think, appropriate. The concern there, though, is that the reporting burden for this may be a little bit too great for some of the things that are maybe asking and expecting too much to be reported. It's that administrative work that then becomes prohibitive sometimes. I mean, there's already a lot of administrative burdens that we're facing, and any more paperwork is not a good thing.